The pharmaceutical industry is putting its army of lobbyists into overdrive. Some of them former members of Congress who influenced laws that benefited the very industry they later joined. The so-called revolving door is perfectly legal, yet it leads critics to ask whether some on Capitol Hill, who are supposed to be watching out for taxpayers, have other interests. In 2003, the pharmaceutical industry got a multi-billion-dollar windfall with Medicare Part D, prescription drug coverage for seniors. Congressman Billy Towson and Senators John Breaux and Don Nichols each held key roles in passing or shaping Part D. All three then left their government jobs and became lobbyists for the pharmaceutical industry. Towson reportedly earns a $2 million salary to head up the biggest pharmaceutical lobby group, Pharma. Breaux and Nichols have started lobby firms that are each pulling in six figures from the drug industry.
There was sort of a mass exodus of members of Congress and staffers to go work for either pharma or pharmaceutical companies.
The nonprofit journalism group ProPublica has found 27 former members of Congress and staffers who were major players in Part D and are now working for the pharmaceutical industry on health care reform. The revolving door is dizzying. Lobbyist John McManus worked for Eli Lilly, became a House staffer where he was chief staff architect of Medicare Part D. Now he lobbies for the drug industry. Lobbyist Michelle Easton worked on Part D in the Senate, became a vice president of Pharma, went back to the Senate as a staffer, and now lobbies for Pharma. One congressional staffer who made the leap to the pharmaceutical industry after Medicare Part D told CBS News, "Every time a major bill passes, there is an exodus of Hill staffers. People are willing to pay a premium for their knowledge. As long as ethics laws and rules are followed, why shouldn't they have that opportunity?" It's worked out nicely for the pharmaceutical industry. It spent at least $18 million lobbying Congress on health care reform, and so far has fought off two proposals that would cost it billions, allowing cheaper drugs to be imported from Canada and lowering drug prices for some Medicare patients. Nobody we mentioned would agree to an interview. In 2007, Towson told 60 Minutes he joined Pharma after drugs cured him of cancer, not because he'd worked on Medicare Part D.
A short time later, you go to work for the drug lobby at a salary of $2 million.
There's nothing I could have done in my life after leaving Congress that I didn't have some impact on in 25 years in Congress. And if that looks bad to you, have at it. That's the truth.
A so-called cooling off period hasn't slowed the revolving door. Ex-members of Congress and their top staffers are required to sit out 1 to 2 years before lobbying former colleagues. Some have gotten around that by entering the lobby world under the title of advocate and advising others how to lobby.